Imagine a patient already grappling with the pain of an open wound, facing the added anxiety of needle injection. In emergency settings, this is a common scenario that can escalate the patient's discomfort and fear. Dr. Steve F. Bierman's innovative approach provides a solution to this problem, offering a method to make injections almost painless. As clinicians, medical residents, and doctoral students, envision transforming your approach to wound care with this simple yet powerful technique. Dr. Stephen F. Bierman's technique draws on the principle that hypnosis and distraction can alter the perception of pain. While topical anesthetics have been used to reduce pain, these often fall short for deeper wounds. Dr. Bierman's method, leveraging the two-finger confusion technique, offers an effective drug-free alternative that requires no additional time but delivers remarkable results. The two-finger confusion technique redirects the patient's attention away from the injection site. Through tactile distraction, this technique minimizes discomfort by engaging the patient's focus in a task that creates mild confusion, making the injection experience virtually painless. This technique works best when utilizing verbal ambiguity, such as one finger or two fingers, to deepen the confusion and induce a trance-like state without a formal hypnosis induction. The technique involves placing one finger on each side of the wound and using ambiguous instructions to distract the patient. As the injection is administered, the patient's attention is diverted, significantly reducing the awareness of the needle's presence. The core of the idea of the two-finger confusion technique to shift the patient's focus from the painful stimulus to a cognitive task involving tactile sensations. By using wordplay such as one finger or two fingers, the technique creates a mild confusion that engages the patient's cognitive resources, reducing the perception of pain. This confusion helps to reduce a trance-like state, making the injection experience less noticeable. For example, as I place my fingers on either side of the wound, focus on the feeling under my right finger. Notice how it feels different from the feeling under my left finger. Now let's play a little game with these fingers. I'm going to wiggle finger one and then finger two, and then probably both fingers at the same time. Notice how each sensation changes as I keep moving my fingers. Which one feels more intense to you? Keep switching your attention between finger one and finger two. The patient might respond with, "I'm noticing different sensations on each side." The physician should continue to alternate the pressure and direction of the fingers, helping to distract the patient with a play on words. If the patient expresses confusion, the physician can simply repeat, "Just focus on finger one or finger two." You can think of them as finger one and finger two to help differentiate the sensation. How does this one feel now versus finger two? Helps further distract the patient. To practice this technique effectively, use a drawing on a piece of paper to map out the instructions and finger placements. This visual aid helps ensure that the words one finger and two fingers are used correctly and consistently. Draw a simple diagram showing the positions of the fingers and label them as finger one and finger two. Aid verbal clarity to maximize confusion in order to elicit a light trance. Dr. Bierman's method has been tested in over 50 cases, with none of the patients reporting significant pain during the injection. Many were unaware the injection had been administered, demonstrating the technique's effectiveness in reducing discomfort. The technique leverages the brain's capacity to handle limited sensory information by redirecting attention to tactile distraction and using ambiguous language. The brain's processing resources are diverted from pain, reducing its perception. Here are some action steps. Prepare a sterile field and instruct the patient to look away. Place one finger on each side of the wound. Begin the distraction process by gently moving your fingers, giving the instructions to focus on the different sensations, using ambiguous language to increase confusion. Administer the injection while maintaining the distraction. Avoid mentioning or displaying the needle to the patient. Use calming and ambiguous language to prevent anticipatory anxiety. Maintain a soothing tone to guide the patient through the distraction process effectively. The best healthcare professionals enhance patient comfort by mastering techniques just like this one. It provides a simple and effective way to reduce pain and anxiety during procedures, improving the overall patient experience. Imagine the positive impact on patient satisfaction when they realize their injection was virtually painless. By incorporating the two-finger confusion technique into your practice, you can consistently deliver this improved experience. The two-finger confusion technique is a valuable tool for making wound injections less painful. By engaging patients in a tactile distraction and using wordplay to induce confusion, healthcare providers can significantly reduce the perception of pain. I encourage all medical professionals to integrate techniques just like this one into their practice. It requires no additional time or medication, but offers a significant improvement in patient care. Mastering techniques just like this can transform the patient's experience, showcasing the power of distraction and innovation in providing compassionate and patient-centered care, because you're perfect just as you are.